Day on WVON. On the live line with me right now, I have Dr. Edith Chernoff, who is joining me from Rabida Children's Hospital. Dr. Chernoff, as you guys know, and this is interesting because I talk about this all the time. Many of us know about Rabida Hospital, but a lot of us know it because we drive by it every day. We go over there by the lakefront and enjoy the view from the lake in the summertime. And yet, do we really know what goes on inside of that hospital? Rabida Children's Hospital has been saving the lives of children for years. Also on the live line with me is Dr. Pamela Northrop from Rabida. And welcome, both of you guys. Welcome to WVON. And Dr. Chernoff, I'll start with you. I say this because, you know, people know the building exists. We're Southsiders. We drive by it every day. Yet I don't really think that the majority of people understand what goes on in that building and doctors that are committing their profession and their lives to the lives of sick children in the city, and it's absolutely amazing. And I speak from this personal experience. My little cousin, Lyric Porter, suffers from sickle cell disease.
I actually know her.
Yes, well, that's my little cousin, and I have spent many a days, as I'm sure you have spent with her mom in there, and just walking through the hallways, you know, and just trying to be focused on Lyric, walking through the hospital and peeking in those other rooms. It really hits you hard when you see these young children in there, you know. Sick.
Right. Well, Rabida has a unique position, and in addition to being on the South Side and very dedicated to serving Southsiders, we are dedicated to serving kids who have a variety of disorders that are chronic, that they're not going to recover from. So not kids who come in, get better, and go away, but kids like your cousin Lyric, who is going to have something that's going to require her to come in and then go home and then come back to the hospital and be here as an outpatient and be here as an inpatient. And so most of our families spend an awful lot of time in the hospital, whether they're coming for rehab or whether they're being admitted or whether they come here to see their specialist and their general pediatrician. Our families spend time here. And people who live on the South Side may have noticed that we actually redid our outpatient building not that long ago. Those who haven't been inside won't know that we redid our inside also because it's important to have a pleasant environment and an updated environment.
Yeah, it is. You know, and I appreciate it too, going in there, the way the hospital is styled for the children. But I cannot say enough about the work that you guys do over there. You know, both you as a doctor and the non-doctors, just being in that environment, and it's got to be so emotional because I'm telling you, man, when I go in there, I am just like, wow, thank God for Rabida Hospital. I hope I'm not over-talking.
Well, it's a little dramatic, but I have to tell you that those of us who work here really feel like we are dedicated to the families and the kids that we see here. And in fact, we are always trying to innovate and to try to do things that are going to make life better for our families and our kids. And you know, I run a particular program here that's for young kids, so children who are 6 years and younger. And we are working on making that program has a team that works with the families. I have a nurse case manager, I have a social worker, family advocacy, I have a nutritionist, and I've got skilled case management. And that's something we've been doing for about 10 years to help families who have kids who have multiple disorders or developmental disorders, to help give them all the supports that they need to navigate the complex systems in the hospital and outside. And one of the things we were going to talk about this morning is how we have now tried to expand that to also give some therapeutic services, so to have infant development work on and a behavioralist to support families in bonding with their kids. And we know that those are services that are very hard to get anywhere.
And I would imagine that's where Pamela comes in.
Pamela.
Yes, that's where Pamela comes in. And thank you so much for your kind words about Rabida. Those of us who work here feel very fortunate to have the opportunity to serve our families. So in terms of people are often not aware that the state, in taking care of patients with special health care needs, when they come in for their appointments, we get paid for the doctor's visit, which is a limited amount of funds, but we do not get any funding for all the supports that Dr. Chernoff mentioned and what it takes to really help support the families and the children to get the services that they need. And so Rabida goes after grant money to be able to do this, and we're very fortunate that we have a very robust team in all of our programs to be able to help support the families. There's so many additional needs that the families face. So, for example, many children that are born premature, which is one of the focus of our program, need special nutrition, that they can't gain weight the way typically developing children are. So we have a nutritionist in the program to be able to help make sure that they get the proper nutrition. There's specialized formulas, so we help support them to get that. There's many things that we do that is just part of who we are and how we help support the families. If the family's having any type of crisis, they call up our social worker. They might be having to relocate. We help support them in looking at what the opportunities are. So we go way beyond the child's medical care, because it is our belief that in order to serve the children and help them be as healthy as they can, it is supporting the whole entire family. And in addition, we will see the children that are not the child that has a special health care need. We will see the whole family, not the parent, but all the siblings, if that is something the family would like to do, so that it's one doctor to know it's one pediatrician rather than having to work with the others at different facilities.
We also work very hard to try and coordinate appointments so that if someone's coming to see one physician, to see if they could see two physicians on the same day, so that they only have to make the trip once. Right. Families spend so much time with medical care when they have sick kids that anything that can make it easier, anything that can mean one less place to go and one less afternoon of work to take off and one less day of school to miss.
And Pamela, I didn't introduce Pamela correctly. She's a licensed clinical social worker, and you deal with the families. And, it's not easy. I mean, it's not easy looking at children that are sick, but at the same time, parents of sick children, I mean, that is very stressful for them and emotional for them. And I know, Pamela, and you too, Dr. Chernoff, I mean, you guys deal with both ends of that spectrum where parents, are in a good mood, they're optimistic, but then, they see their children in pain, and I know they vent out on you guys from time to time, and you guys just do an incredible job of dealing with that.
I think that anyone who works with families knows that those are things you don't take personally. In fact, those are signals that it's time to see if there's some other supports that you can put in place, right? Instead of saying, wow, that wasn't so nice, you turn around and you go, gee, I think you're having a stressful moment. Is there something we can do to help? What's going on?
And I know that's not, obviously we all understand it because nobody wants to see their children in pain. If the world was right, a place like Rabida would never have to worry about money. And I want to know whatever we can do to help you guys to that end, please let us know, because as you guys can tell, I just admire what that building does and the work that you guys do there as professionals.
Right. Well, we're very happy to be chatting with you this morning so that we can so that we can get the word out, that people can know what we do, that we're not just a beautiful building on the lake, and it is a beautiful environment. You come out here, I mean, it's just lovely. But really, it's the work that goes on inside the building that's important. And that people are around to give support. We do a lot of things at Rabida that you can't do. They don't do at other hospitals. I mean, we have a full rehab team here, and rehab facilities that are designed just for children. Including a pool therapy and a gym. You come in, it looks like it's friendly. It doesn't look like you're there for rehab. It looks like you're there to play.
Yeah, it is an amazing place, an amazing facility. And like I said, most people, as you said, Doctor, we're used to knowing Rabida because a lot of people go over there because of the location, and they set up the barbecue grill, and they like the view over there. But what goes on in that building is incredible, and incredible people there doing the work. MJ is calling us from Chatham and wants to get in on this conversation. MJ, good morning.
Good morning, Matt, and to your guest. Thank you for allowing me to say some special words to your guest about the care, the loving care that they provide to the children of Rabida. Special to me were my great nieces were there, and they were 1.5 pounds, I think, when they were born. and got excellent care. Their grandma Dolores, who has reared them, has brought them a long way. They're 10 years old now, and they are beautiful girls, very articulate, very intelligent, and have a promising future thanks to Rabida. And we can't say enough. I'm over there always looking at the beautiful background, but we know what's in the confines of the building. So keep up the great work.
Oh, thank you for your kind words.
And they were babies of the month, in fact.
Very nice.
They were babies of the month. That's right.
That's right. Well, we see a lot of kids who were born early, a lot of twins because they're at risk. It's always good to hear when somebody's done well. That's always our goal, is that we support you through the tough times when they're really, really little. We take them from being able to fit into your palm to being eloquent young ladies, and that's the goal.
Well, we thank you and keep up the great work. You're much appreciated.
Thank you for that. Yeah. I think that in our kids program, the bulk of our kids were born early, and there's all sorts of risks to children who were born early. Also, they spend a lot of time in the hospital, and so that's a very big stress on families. And that's why we're particularly excited about being able to have some of our infant development specialists work with families to sort of reduce some of that stress, help them find fun things to do with their kids. Play time with kids who are impaired is very, very important, but sometimes families don't know exactly how to go about doing that. And so we're particularly excited about having those new supports.
I just want to say from my family, thank you, because, my cousin Lyric has spent a lot of time in Rabida, and I look at her today, she's 18 years old. 19 years old, actually, just had a birthday. She's going to college, just finished her freshman year at Florida A&M University. And, her life is about as normal as it can be for a 19-year-old because of Rabida. And that's coming from the bottom of my heart.
Well, we appreciate all those kind words. And one of the other things that we would like to let people know that if they have any questions or want to know, is Rabida the right place for their child, I would be glad to talk with them. Sometimes in terms of what they're looking for, and I could help figure that out with them.
Yes.
So I welcome any calls from any parents who want to discuss what their child needs. I could give my number right now.
You should.
And my name is Pam, and my number is 773-256-5957. Again, 773-256-5957. I welcome any calls. That's a confidential line, so anyone could leave any message that they want about their child and just wanting to discuss what their needs are. And that's what we're all about, letting families know that we're out there to help support them in taking care of their children.
I have that number written down, so if any of the callers want to call in, I can give you that number. I will tell you myself, yes, Rabida is the place where you want to go. I got one more call before I let you guys go. Willie on the north side wants to make a comment as well about Rabida.
Man, Matt, you did it again. I'm trying not to cry.
Brother, I am over here, so.
I would be dead without Rabida. They sent me to Michael Reese. They couldn't do anything. They told my mother I would die. They shipped me off to Rabida. I spent 6 months. Doctors at Michael Reese told my mother I'd never walk again. Rabida, 6 months in Rabida. I will be calling them. If I can do anything to help, I'll absolutely help. I would not be here without that hospital. And that was almost 40 years ago.
Wow.
Wow, that
was more than 40 years ago.
It's amazing, man.
That hospital's been doing great work for a long, long time.
Wow. So, Willie, thanks for that testimony. Willie's one of our dedicated listeners. I had an opportunity to meet him a couple of weeks ago, and just an incredible testament to the work that Rabida does there. Thanks for that call, Willie.
Thank you. You do a great job, Matt.
Thanks,
Crazy
man.
Good.
Well,
Thank you.
Now that we all are watery-eyed here at WVON, needless to say, Dr. Chernoff and Pamela Northrop, needless to say, the work that you guys do. And I'm sure there are a lot of our listeners that are probably shaking their head and saying the same thing. Pamela, I have your number. If there's any other information, please don't hesitate to give to it. I will be your spokesperson for whatever you guys want to do. We need to make sure that Rabida is not only here, but that it continues to save lives in our community. Thank you guys so much for coming on the show today.
Thank you for having us.
Yeah.
Bye.
Incredible. And I've got Pamela's number here. If anybody wants to call and get that number, I've got it for you. Call on in. Dr. Edith Chernoff and Pamela Northrop, Rabida Hospital. All right, as I dry my eyes here, man, because I'm thinking about my little cousin Lyric, the show continues. 8:22 traffic and weather coming up next.